Hello everyone! Imagine walking into a barbershop for a haircut. The barber welcomes you. He sharpens his blade. But then you notice something strange. The man beside you is not getting a shave. He is having a tooth pulled out. Another customer is waiting for bloodletting. And a wounded soldier needs his leg removed. In medieval Europe, the person cutting your hair might also cut into your body. So why were surgeons also barbers? And how did a barbershop become one of the first places people visited for medical treatment? You enter the shop. Sit down. The barber grabs a blade. Haircut? Maybe. Shave? Possibly. Surgery? Also possible. Medieval barber surgeons offered far more than grooming. They pulled teeth. They opened painful abscesses. They treated wounds. They performed bloodletting. Some even removed damaged limbs. There was no bright operating room, no medical monitor, no modern anesthetic, only basic tools, strong hands, and a patient hoping the barber knew what he was doing. This sounds bizarre today. Back then, it was practical. Barbers were everywhere. Trained physicians were not. Medieval physicians had status. They studied books. They learned theories. They examined urine. They prescribed diets and medicine. But many avoided surgery. Cutting the body was viewed as manual work. It was bloody. It was messy. It belonged to a lower social rank. Wealthy physicians preferred to diagnose the problem and leave the cutting to someone else. Surgeons learned through practice, not only through books. They treated real wounds. They used their hands. The medical world was divided. Physicians explained what was wrong. Barber-surgeons were often the ones expected to do something about it. Barbers already owned the right tools. They had sharp razors. They had steady hands. They understood how to work close to the skin without cutting too deeply, at least during a normal shave. They were also easy to find. Nearly every town needed someone to cut hair and trim beards. Over time, some barbers began offering simple medical procedures. They learned through apprenticeships. A young trainee watched an experienced master, cleaned the tools, held patients still, and slowly practiced the same techniques. This was hands-on education. It could produce real skill. It could also produce terrible mistakes. Bloodletting was one of their most common services. Medieval medicine taught that illness could come from an imbalance of fluids inside the body. Removing blood was supposed to restore that balance. The barber tied the patient's arm, found a vein, and opened it with a small blade called a lancet. Barbers also pulled painful teeth. There were no modern injections, no electric drills. The patient sat down, opened their mouth, and hoped the tooth came out quickly. Barber-surgeons also opened boils, treated small wounds, and set some broken bones. For ordinary people, they were the most accessible medical workers. War created constant work. Soldiers suffered deep cuts, crushed bones, arrows, and gunshot wounds. Barber-surgeons followed armies and treated the injured near the battlefield. Sometimes a limb could not be saved. Then came amputation. Speed mattered. There was no safe general anesthesia for most of this period. The surgeon cut through skin and muscle, then sawed through bone. A fast operation reduced the time a patient spent in extreme pain. But not every barber performed major surgery. Skilled masters handled the hardest cases. An ordinary village barber was not automatically ready to remove a leg. Surgery was terrifying. Pain was only the beginning. Barber surgeons did not understand bacteria or germ theory. Their instruments were not sterilized in the modern sense. The same blade might be used again and again. Dirty hands and contaminated tools could infect a wound. Bleeding was another major danger. Surgeons tried pressure, bandages, cauterization, or heated metal to close wounds. Some patients survived the operation but died days later from infection. Others never survived the shock. Still, surgery could be the only option. A rotten tooth, infected wound, or destroyed limb could also kill you if nobody acted. The barber pole may preserve part of this medical history. Its red stripe is commonly linked with blood. The white stripe is associated with clean bandages. Some versions also include blue, though its meaning is debated and differs between countries. During bloodletting, a patient could grip a pole or staff to make the veins in the arm easier to see. Bandages may then have been wrapped or displayed nearby. Over time, the striped pole became a symbol of the barber's trade. Today, it promises haircuts and shaves. But its colors still remind us that barbers once offered services far more dangerous than trimming a beard. Surgery slowly became more organized. Training improved. Anatomy became more important. Surgical guilds began examining practitioners and controlling who could work. In London, barbers and surgeons were formally united in one company in 1540, but their professions kept changing. Surgeons wanted greater respect and a separate identity. In 1745, they finally split from the barbers. Surgery later developed into a specialized medical profession with hospitals, anesthesia, antiseptics, and years of formal education. The barber kept the razor. The surgeon kept the scalpel. But for centuries, both tools could be held by the same person.